1. A nurse observes a colleague recap a used needle after administering an injection. What is the appropriate action by the nurse? 1. Report to infection control. 2. Ignore the action. 3. Educate the colleague privately. 4. Remove the needle immediately. Answer: educate the colleague privately. Rationale: recapping needles increases the risk of needle stick injuries. Addressing it immediately helps prevent future harm and maintains a supportive work environment. 2. A patient with a suspected norovirus infection is placed in isolation. What type of precautions should be used? 1. Droplet. 2. Contact. 3. Airborne. 4. Standard only. Answer: contact. Rationale: norovirus is highly contagious and spreads via direct and indirect contact, requiring contact precautions. 3. Which action should a nurse take when transporting a patient with influenza to another department? 1. Have the patient wear a surgical mask. 2. Wear a gown and gloves only. 3. Delay transport until precautions are lifted. 4. No special action needed. Answer: have the patient wear a surgical mask. Rationale: influenza spreads via droplets, and the patient must wear a mask to prevent transmission during transport. 4. What is the primary purpose of antimicrobial stewardship programs in hospitals? 1. Reduce healthcare costs. 2. Improve patient satisfaction. 3. Prevent antimicrobial resistance. 4. Shorten length of stay. Answer: prevent antimicrobial resistance. Rationale: antimicrobial stewardship programs aim to optimize antibiotic use and minimize resistance. 5. When preparing a sterile field, what action invalidates sterility? 1. Opening supplies away from the field. 2. Holding sterile items above the waist. 3. Turning your back to the sterile field. 4. Adding sterile gloves with sterile forceps. Answer: turning your back to the sterile field. Rationale: the sterile field must always be in view to ensure it is not accidentally contaminated. 6. A nurse is caring for a patient on neutropenic precautions. Which food should be avoided? 1. Cooked chicken. 2. Canned fruit. 3. Fresh strawberries. 4. Pasteurized milk. Answer: fresh strawberries. Rationale: fresh fruits can harbor bacteria and fungi that pose a risk to immunocompromised patients. 7. Which item should not be brought into the room of a patient on protective isolation? 1. Disposable thermometer. 2. Sterile gauze. 3. Fresh potted plant. 4. N95 mask. Answer: fresh potted plant. Rationale: soil from plants may contain microorganisms harmful to immunocompromised patients. 8. A nurse is about to administer medication via central line. What is the most critical first step? 1. Check medication label. 2. Don gloves. 3. Scrub the hub. 4. Assess for catheter patency. Answer: scrub the hub. Rationale: disinfecting the access port is crucial to prevent catheter-related bloodstream infections. 9. Which behavior indicates a need for further infection control training? 1. Wearing gloves when handling blood. 2. Using alcohol gel after removing gloves. 3. Wearing rings while washing hands. 4. Changing gloves between patients. Answer: wearing rings while washing hands. Rationale: rings can harbor microbes and interfere with effective hand hygiene. 10. Which of the following nursing actions best prevents catheter-associated urinary tract infections? CAUTIS 1. Irrigate the catheter every shift. 2. Keep the drainage bag above the bladder. 3. Secure catheter to thigh. 4. Use a large diameter catheter. Answer: secure catheter to thigh. Rationale: proper stabilization prevents urethral trauma and lowers infection risk. 11. A nurse is changing the linens of a patient on airborne precautions. What PPE is essential? 1. Gown and gloves. 2. Surgical mask. 3. N95 respirator. For goggles only. Answer: N95 respirator. Rationale: airborne pathogens require the use of a respirator to prevent inhalation of infectious particles. 12. When preparing to insert a urinary catheter using sterile technique, the nurse brushes against the sterile drape. What should the nurse do next? 1. Continue the procedure. 2. Notify the charge nurse. 3. Replace the sterile drape. 4. Ask for assistance. Answer: replace the sterile drape. Rationale: Once sterility is compromised, the affected materials must be replaced to maintain asepsis. 13. A nurse must draw blood from a patient with a central line. What infection control step is essential? 1. Use gloves only. 2. Scrub port for 15 seconds with alcohol. 3. Use clean technique for avoid flushing line. Answer. Scrub port for 15 seconds with alcohol. Rationale. Proper disinfection of the port is vital to prevent bloodstream infections. 14. Which situation warrants contact precautions? 1. Patient with pertussis. 2. Patient with RSV infection. 3. Patient with measles. 4. Patient with tuberculosis. Answer. Patient with RSV infection. Rationale. RSV is primarily transmitted via direct contact with secretions. 15. What is the most important step in preventing cross-contamination between patients? 1. Wearing gloves. 2. Isolating patients. 3. Practicing hand hygiene. 4. Using face masks. Answer. Practicing hand hygiene. Rationale. Hand hygiene is the most effective method for preventing the spread of infections in healthcare settings. 16. A nurse is caring for a patient with C. difficile. What is the correct method of hand hygiene after providing care? 1. Alcohol-based sanitizer. 2. Soap and water. 3. Bleach wipe on hands. 4. Disposable gloves only. Answer. Soap and water. Rationale. C. difficile spores are resistant to alcohol-based sanitizers and must be washed off with soap and water. 17. When removing PPE after patient care, which items should be removed first? 1. Gloves. 2. Gown. 3. Mask. 4. Goggles. Answer. Gloves. Rationale. Gloves are the most contaminated item and should be removed first to prevent self-contamination. 18. A patient on contact precautions needs physical therapy. What should the nurse ensure before transport? 1. Patient wears a surgical mask. 2. Therapy is canceled. 3. Surfaces are disinfected after use. 4. Patient wears sterile gloves. Answer. Surfaces are disinfected after use. Rationale. Equipment used by contact isolation patients must be cleaned after to prevent the spread of infection. 19. A nurse prepares to administer an injection and notices the alcohol swab touch the bed rail. What is the correct response? 1. Use it anyway. 2. Use a new alcohol swab. 3. Blow on it to dry. 4. Wipe again with same swab. Answer. Use a new alcohol swab. Rationale. Once contaminated, a disinfectant swab should not be used. A new sterile one is needed. 20. A nurse is caring for multiple patients. Which task should be completed last? 1. Dressing change for a clean surgical wound. 2. Bathing a patient with open pressure ulcers. 3. Feeding a post-stroke patient. 4. Changing linens for a patient with C. difficile. Answer. Changing linens for a patient with C. difficile. Rationale. Patients with infections requiring contact precautions should be cared for last to prevent transmission. 21. A nurse is preparing to perform wound care on a patient with a draining MRSA-positive ulcer. What is the most appropriate personal protective equipment PPE to wear? 1. Gown and gloves. 2. Gloves only. 3. Gown, gloves, and N95 mask for mask and face shield. Answer. Gown and gloves. Rationale. Contact precautions require gown and gloves to prevent the spread of MRSA through direct contact with drainage or contaminated surfaces. 22. A newly hired nursing assistant is caring for a patient on droplet precautions. Which action requires intervention by the nurse? 1. Wearing a surgical mask. 2. Keeping the patient's door closed. 3. Placing the patient in a private room. 4. Washing hands after removing gloves. Answer. Keeping the patient's door closed. Rationale. For droplet precautions, the door may remain open. Closing the door is unnecessary and may reflect a misunderstanding of protocol. 23. A nurse notices a visitor entering a patient's room on airborne precautions without PPE. What should the nurse do first? 1. Notify infection control. 2. Ask the visitor to leave the room. 3. Provide appropriate PPE and educate. 4. Report to hospital administration. Answer. Provide appropriate PPE and educate. Rationale. Immediate intervention with education helps ensure safety and promotes understanding without delay. 24. A nurse is assigning rooms for new admissions. Which patient is most appropriate to place with a patient on contact precautions? 1. A patient with COPD. 2. A patient with an open burn wound. 3. A patient with similar organism and same precautions. 4. A patient with neutropenia. Answer: a patient with similar organism and same precautions. Rationale: cohorting is acceptable only if both patients have the same pathogen and require the same level of precautions. 25. What is the priority nursing action after a needle stick injury with a contaminated needle? 1. Report the incident. 2. Wash the area with soap and water. 3. Begin antiviral therapy. 4. Notify occupational health. Answer: wash the area with soap and water. Rationale: immediate washing of the site is the first priority to reduce the risk of pathogen transmission. 26. A patient with active pulmonary tuberculosis is scheduled for discharge. What is the most important discharge teaching? 1. Avoid sunlight. 2. Take medications with food. 3. Wear a mask in public. 4. Avoid dairy products. Answer: wear a mask in public. Rationale: TB is airborne. Wearing a mask helps prevent transmission to others until the patient is no longer infectious. 27. A nurse is delegating care to an unlicensed assistive personnel, UAP. Which task should not be delegated for a patient with C. difficile? 1. Feeding the patient. 2. Transporting the patient in a wheelchair. 3. Cleaning reusable equipment. 4. Assisting with bathing. Answer: cleaning reusable equipment. Rationale: cleaning and disinfection require knowledge of proper technique and chemicals, which is a nursing responsibility. 28. During a sterile procedure, a nurse accidentally brushes the sterile glove against a non-sterile surface. What should the nurse do next? 1. Continue carefully. 2. Change the glove immediately. 3. Notify the provider. 4. Discard all sterile items. Answer: change the glove immediately. Rationale: any breach of sterility requires immediate correction to maintain aseptic conditions. 29. What is the correct method to dispose of a used isolation gown? 1. Shake it before discarding. 2. Fold it with contaminated side out. 3. Roll it inside out and discard in designated bin. 4. Place it in laundry bag. Answer: roll it inside out and discard in designated bin. Rationale: rolling the gown inside out prevents dispersing contaminants and ensures safe disposal. 30. A nurse is caring for 4 patients. Which patient should be seen first based on infection control principles? 1. A patient with neutropenia reporting sore throat. 2. A patient with a healing surgical wound. 3. A patient needing for antibiotics. 4. A patient ready for discharge. Answer: a patient with neutropenia reporting sore throat. Rationale: neutropenic patients are at high risk for sepsis from minor infections and require immediate assessment. 31. A patient with hepatitis A is incontinent of stool. What type of isolation is most appropriate? 1. Standard. 2. Contact. 3. Droplet. 4. Airborne. Answer: contact. Rationale: hepatitis A is transmitted via the fecal-oral route. Incontinence increases risk of environmental contamination. 32. After suctioning a tracheostomy, what is the correct next step to reduce infection risk? 1. Discard gloves. 2. Wash hands. 3. Disinfect suction tubing. 4. Chart the procedure. Answer: wash hands. Rationale: hand hygiene after glove removal is the most effective measure to prevent transmission of microorganisms. 33. A nurse prepares to insert an N4 catheter. Which step must be performed before touching the insertion site? 1. Apply tourniquet. 2. Open catheter package. 3. Wash hands. 4. Shave hair from the site. Answer: wash hands. Rationale: hand hygiene is essential prior to any invasive procedure to maintain aseptic technique. 34. A nurse is teaching a new UAP about caring for a patient with vancomycin-resistant enterococcus, VRE. Which statement indicates understanding? 1. I need a gown and gloves before entering the room. Answer: I need a gown and gloves before entering the room. Rationale: VRE requires contact precautions, including PPE, upon room entry. 35. A nurse is reviewing infection control with a patient who has a central venous catheter at home. Which instruction is most important? 1. Use sterile gloves. 2. Avoid bathing. 3. Cleanse the port with alcohol before use. 4. Flush with saline twice daily. Answer: cleanse the port with alcohol before use. Rationale: disinfection of access ports is a critical step in preventing bloodstream infections. 36. In which situation should the nurse wear eye protection? 1. Administering oral medications. 2. Starting a peripheral. 4. 3. Suctioning a tracheostomy. 4. Assisting with ambulation. Answer: suctioning a tracheostomy. Rationale: eye protection is needed during procedures with potential for splash of body fluids. 37. A patient on droplet precautions needs assistance ambulating in the hallway. What is the correct nursing action? 1. Postpone ambulation. 2. Provide a surgical mask for the patient. 3. Wear an N95 mask. 4. Have the patient wear gloves only. Answer: provide a surgical mask for the patient. Rationale: surgical masks prevent droplet spread from the patient to others during ambulation. 38. A nurse assesses a newly admitted patient who has chronic diarrhea and a recent history of antibiotic use. What action should be taken first? 1. Obtain stool sample. 2. Initiate contact precautions. 3. Notify the provider. 4. Review medication history. Answer: initiate contact precautions. Rationale: symptoms suggest C. difficile infection. Precautions must begin immediately to prevent spread. 39. A nurse educator is teaching staff about hand hygiene. Which scenario demonstrates appropriate use of alcohol-based hand sanitizer? 1. After caring for a patient with C. difficile. 2. After removing gloves following a wound dressing. 3. After toileting a patient. 4. Before eating. Answer: after removing gloves following a wound dressing. Rationale: alcohol-based hand rubs are effective unless dealing with spores or visibly soiled hands. 40. Which intervention helps prevent ventilator-associated pneumonia? VAP1. Frequent oral suctioning. 2. Elevate head of bed 30 to 45 degrees. 3. Administer antibiotics routinely. 4. Increase sedation for comfort. Answer: elevate head of bed 30 to 45 degrees. Rationale: proper positioning reduces the risk of aspiration, a major cause of VAP. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!